I'm Devin Minior. I'm the physician executive for Banner Urgent Care Services. The symptoms of the measles typically will start about 7 days after initial exposure. Those symptoms can include cough, fever, runny nose, red eyes, irritation. Typically 3 to 4 days after those symptoms, a rash will begin. And that rash will typically begin on the scalp line and go down to the face, torso, and the extremities.
My name is Gina Montion. I'm a pediatrician at Banner Health. The MMR vaccine is the measles, mumps, and rubella vaccine. It's given twice, once at 12 months and then again at 4 years old. It's considered 93% effective to prevent measles after one dose. After your second dose, it's up to 99% effective.
My name is Michelle Ruha. I'm a medical toxicologist at Banner Health. The MMR vaccine is very safe. There are some side effects that can occur, such as soreness in the muscles at the site of the injection. Sometimes people can get a fever. There are very rare allergic reactions, and really not many other side effects. It's a very safe vaccine. The MMR vaccine does not cause autism. This is a settled question. There's plenty of evidence to show that the MMR vaccine is safe and that there is no association with autism. The MMR vaccine does not cause measles. It is a live attenuated virus, but it's in its weakened form, so people who get the vaccine do not develop the virus. Vaccines are not toxic. There is a lot of misinformation on the internet that leads to a lot of confusion for people, but really vaccines do not produce any type of toxicity. The MMR vaccine in particular does not contain mercury. Some people do have concerns about thimerosal in vaccines, but really thimerosal has been removed from most vaccines except for some multi-dose vials of the flu vaccine. Thimerosal is a mercury-containing compound, but even vaccines that contain thimerosal have been shown to be safe, and people are not exposed to enough mercury or a form of mercury that produces any type of toxicity in people.
My name is David Moromisato. I'm the Chief Medical Officer at Banner Children's at Carden Children's Medical Center. Herd immunity is a concept that protects populations from contracting infectious diseases, especially as it relates to vaccine preventable diseases such as measles. The importance of it is it protects an entire population and also those that are actually susceptible to it, such as babies who are not yet immunized. If we get below a level of 95% immunization, then a population and its most susceptible children or elderly are at risk for contracting the disease.
If you are planning to travel with an unvaccinated infant because they're too young, you should be talking to your pediatrician about whether or not your baby may need to get the MMR vaccine. Right now, the current recommendation is babies 6 months and up who are unvaccinated should get the MMR if they are traveling internationally. Domestically, you may need some further guidance from your pediatrician. If your child does get the vaccine between 6 months to 12 months of age, before their first birthday, they will still need that 1 year, 12-month vaccine and their 4 to 6 year old MMR vaccine.
The best way to protect your children in the event of an outbreak of measles is to have them vaccinated. That is the most reliable way. You'll have 93 to 97% assurance that they will be immunized. However, if they are not immunized yet because they're too young, you must avoid areas in which there is recirculated air, such as large buildings, airplanes. Also avoid areas that have high public traffic, such as airports, schools, daycare, where there are a lot of people in small spaces. And then finally, the concept of using a mask to protect your child. Measles is actually airborne. So it goes through, it can contract through the eyes. It goes around the areas of the mask, so it is really not protective.
I would like to tell vaccine hesitant parents to trust their physicians and the CDC and the people who have carefully studied the vaccine and understand the benefits and the risks. The community needs everyone to be vaccinated. If people just decide not to get vaccinated, they don't only put their own children at risk or themselves at risk, they put our entire community at risk. There are some people who are not able to get vaccinated because they are too young, or they may have diseases that have depressed their immune system, so they can't get the vaccine. And then they are at risk because of all those who are really healthy and able to get the vaccine but choose not to do so because of fears that are really unfounded.